Hi, it's Derek here at Midlands Physical Therapy and Mote. Now, if you are struggling with back pain that's stopping you from being as active as you'd like to be, it's just getting in the way of you getting a good quality night's sleep, or it's just stopping you from doing things to the best of your ability and you're not able to enjoy going out, or you're not able to enjoy watching a match, then I would like to take a few minutes just to answer some questions that I often get asked by people who come into me in the clinic who are suffering with back pain. Now, back pain is by far the most common condition or common problem that I treat, and I see people with back pain every day in the clinic. Now, some of the questions they ask, so the first one is, should I rest or should I keep moving? Now, the answer to this is that you should try and do a little bit of both, depending on how bad it is and depending on where you're feeling the symptoms. It is good to keep moving, but obviously if you move too much, it's going to hurt. So movement is good, but move to the best of your ability. So if you do too much, it starts to get sore, then that's time to take a rest. Now, on the other side, if you rest too much, it's also going to be quite sore and quite stiff when you get up. So you have to find a happy balance between the two, and you have to sort of use a little bit of your own judgment for this. But my overall advice would be to try and keep moving. Moving is good because you're going to use the muscles around the leg, the hip, and you're also going to be get some movement into the lower back muscles, which may help feed them out a little bit. But you have to use your sense here as well. Too much movement, or if you do too much, you're going to be sore afterwards. Now, the second one is hot or cold. Now again, the problem with these is that they're treating the symptom. So the symptom is the pain, and they're not actually going to treat the true cause. So by putting heat or by putting cold on it, it might make it feel a little bit better, and this is going to be entirely up to you as well. So some people find heat really good, some people find cold really good, some people find no benefit from either. So my advice would be to try it out, try one of them. If you get relief from it, stick with that. If you don't, try the other one. If you don't get relief from that, then it's not going to work for you. But if it helps relieve the pain a little bit, then that's the one for you. Okay, number 3, should you stretch or not? So a little bit of movement is good. Stretching is going to be similar to moving, and you don't have to go crazy and stretch every muscle in the body, but a little bit of movement into the lower back is going to be nice, just to help try and loosen those tissues and to try and help relieve it a little bit. Obviously you have to use your own judgment here and your own sense. If you're quite restricted and if your bending is very restricted, then it's going to be very hard for you to bend down until those muscles start to relax a little bit. But some movements and some little bit of stretching, very mild, very gentle, is going to be good to try and help reduce the tension in those muscles. And then the last one is painkillers. Now, painkillers again are going to address the pain, which is the symptom, not the true cause. So painkillers are going to be short-term relief. If you're very sore and if you have to go to work that evening, or if you have to do something, or just if you're in a lot of agony, then painkillers, yeah, take them if you want. Take some to help reduce the pain, that's no problem. What we don't want is we don't want to become reliant on them, and you don't want to be taking painkillers before you go out to the shop or you do anything at all where you're anticipating that you may get a little bit of pain, because that's when they become the problem, and that's when you get used to them, and that's when they start to lose their effect and you have to take stronger painkillers. So that can lead to a little cascade or a cycle of problems. That is not the best option. So in the short term, some painkillers is good just to help relieve the pain, but long term it's not going to help solve the problem. So I hope that makes sense. Again, all of these, you have to use your own judgment, and all of them are addressing the pain, not the true cause of the problem. So until the true cause of the problem is addressed, you're always going to get short-term relief from that back problem. But when you go to do something that puts a little bit more stress in the body, that's when the back is going to come back and the back is going to give out and you're going to get that pain again. So that's why addressing the true cause is so important. Okay? Any questions, please leave them in the comments below or get in touch with the clinic. And thanks for watching this video.